Which is the most important step in preventing the spread of infection in healthcare settings? A. Wearing gloves at all times. B. Disinfecting equipment daily. C. Hand hygiene before and after each patient contact. D. Using sterile gloves for all procedures. Answer: C. Hand hygiene remains the single most effective method to prevent infection spread. It eliminates transient microorganisms transferred between patients, surfaces, and caregivers. When should a CNA perform hand hygiene during patient care? A. Only at the beginning of the shift. B. After removing gloves and before leaving the room. C. Only if visible dirt is present. D. Once every hour regardless of tasks. Answer: B. Hands should be cleaned before and after all patient contact, after glove removal, and after contact with bodily fluids to prevent transmission. Which item of PPE should be removed first to minimize self-contamination? A. Gloves. B. Gown. C. Mask. D. Goggles. Answer: A. Gloves are most contaminated and should be removed first to prevent transferring pathogens to other surfaces or parts of the body. Contact precautions are required for a patient with which condition? A. Influenza. B. Tuberculosis. C. MRSA wound infection. D. Measles. Answer: C. MRSA spreads through direct contact, so contact precautions such as gown and gloves are required when caring for affected patients. What is the correct order to remove PPE after patient care? A. Gloves, mask, gown, goggles. B. Gloves, goggles, gown, mask. C. Mask, gloves, gown, goggles. D. Gown, gloves, mask, goggles. Answer: B. Removing gloves first prevents contamination, followed by goggles, gown, and mask last to avoid respiratory exposure. A patient is in airborne isolation for tuberculosis. Which PPE must the CNA wear? A. Surgical mask. B. N95 respirator. C. Face shield only. D. Standard gloves. Answer: B. Airborne pathogens like TB require an N95 respirator that filters airborne particles effectively. Which action breaks the chain of infection at the portal of exit link? A. Wearing gloves when handling body fluids. B. Using sterile equipment. C. Performing hand hygiene. D. Placing patients in isolation. Answer: A. Gloves prevent contact with infectious material as it exits the body, interrupting the chain of infection. A CNA notices a biohazard bag leaking blood. What should be done first? A. Leave it for environmental staff. B. Wipe it with disinfectant. C. Dispose of it in the trash. D. Place it in a clean bag with a biohazard label. Answer: D. Double bagging prevents leakage and ensures safe transport of contaminated materials according to infection control policy. When assisting with oral care for a resident with HIV, what precautions should be taken? A. Standard precautions only. B. Contact precautions. C. Airborne precautions. D. Droplet precautions. Answer: A. Standard precautions are sufficient for all residents, regardless of infection status, to protect against blood-borne pathogens. A CNA must clean up a urine spill on the floor. What should be done first? A. Wipe the spill with paper towels. B. Call maintenance. C. Put on gloves and absorb the spill. D. Spray deodorizer. Answer: C. Gloves protect the CNA from pathogens in body fluids. The spill must be absorbed and then disinfected properly. A CNA accidentally touches a contaminated dressing with bare hands. What is the next step? A. Rinse hands with water. B. Use alcohol-based hand sanitizer only. C. Wash hands with soap and water immediately. D. Apply gloves afterward. Answer: C. Washing hands thoroughly with soap and water removes microorganisms and prevents spread to others. Which action should a CNA take when moving equipment from an isolation room? A. Use it for other patients. B. Disinfect before removing. C. Cover it with a clean towel. D. Store in the hallway. Answer: B. Equipment from isolation rooms must be disinfected before removal to prevent cross-contamination. What is the most effective method to kill Clostridium difficile spores? A. Alcohol sanitizer. B. Antibacterial wipes. C. Hand washing with soap and water. D. UV light. Answer: C. C. Difficile spores resist alcohol, only mechanical friction from soap and water effectively removes them. When should a CNA wear a face shield? A. When feeding a resident. B. When there's risk of body fluid splashes. C. During routine care. D. While delivering meal trays. Answer: B. Face shields protect mucous membranes from splashes of blood or bodily fluids during certain procedures. Which of the following is an example of transmission-based precaution? A. Performing hand hygiene. B. Wearing gloves during mouth care. C. Using an N95 respirator for airborne diseases. D. Labeling personal belongings. Answer: C. Transmission-based precautions add extra protection beyond standard precautions for airborne, droplet, or contact diseases. A CNA removes gloves after cleaning a wound. What should be done next? A. Sanitize gloves. B. Perform hand hygiene. C. Put on new gloves immediately. D. Document the task. Answer: B. Hands must always be cleaned after glove removal because microorganisms can still transfer during removal. Which item is considered PPE? A. Apron. B. Uniform. C. Watch. D. ID badge. Answer: A. PPE includes gloves, gowns, masks, aprons, and face protection items designed to block exposure to infectious materials. A CNA observes another staff member using the same gloves for 2 residents. What should the CNA do? A. Ignore it. B. Report it to the charge nurse immediately. C. Ask the coworker to hurry up. D. Clean the gloves with sanitizer. Answer: B. Reusing gloves spreads infection between residents and violates infection control protocol. It must be reported immediately. Which link in the chain of infection is eliminated by isolating a patient with chickenpox? A. Reservoir. B. Portal of entry. C. Mode of transmission. D. Susceptible host. Answer: C. Isolation interrupts the mode of transmission by preventing spread from infected individuals to others. Which is the correct way to handle soiled linens? A. Shake them before placing in a hamper. B. Carry them close to your uniform. C. Place directly into designated linen bags. D. Rinse them in the patient's sink. Answer: C. Soiled linens should be placed directly in appropriate bags to contain contaminants and prevent airborne particles. A resident under droplet precautions requires transport. What should the CNA ensure? A. The resident wears a mask. B. CNA wears an N95 respirator. C. Transport is delayed. D. Gloves are removed before transport. Answer A. A mask on the resident prevents droplet spread during transport outside the room. The CNA is caring for a patient with influenza. Which precaution is required? A. Contact. B. Droplet. C. Airborne. D. Reverse isolation. Answer B. Influenza spreads via droplets from coughs or sneezes. A surgical mask and gloves prevent transmission. When is it acceptable to reuse PPE? A. Between residents with the same diagnosis. B. Only if PPE appears clean. C. Never. D. After spraying with disinfectant. Answer C. PPE is single-use to prevent contamination. Reusing it risks spreading infection. Which situation requires the CNA to wear sterile gloves? A. Taking vital signs. B. Emptying a urinal. C. Assisting with a sterile dressing change. D. Feeding a patient. Answer C. Sterile gloves are used when performing procedures that involve contact with sterile areas or open wounds. The CNA notices a resident's wound drainage has soaked through the bandage. What should be done first? A. Replace the bandage immediately. B. Report to the nurse. C. Add gauze over it. D. Ignore unless patient complains. Answer B. A nurse must assess the wound for infection and determine the correct sterile dressing procedure. Which of the following reduces the risk of cross-contamination? A. Using the same thermometer for all residents. B. Wearing a mask continuously. C. Double gloving. D. Cleaning shared equipment between uses. Answer D. Disinfecting shared devices between patients prevents pathogens from transferring. The correct way to remove a mask is by A. Touching the front of the mask. B. Untying or removing from the straps. C. Pulling from the mouth area. D. Wiping it with sanitizer. Answer B. Masks should be removed by the straps to avoid touching contaminated surfaces. A CNA should perform hand hygiene after removing gloves because A. Gloves may have small tears or contamination during removal. B. It's required by facility policy only. C. It helps hands stay soft. D. It's optional if gloves are intact. Answer A. Gloves do not eliminate all contamination risk. Handwashing removes unseen pathogens that may pass through microtears. The CNA must dispose of a used sharps container when it is A. Half full. B. 3/4 full. C. Completely full. D. As needed. Answer B. Overfilled sharps containers increase needle stick risk. Disposal at 3/4 full ensures safety. A patient on contact precautions needs linen change. What should the CNA wear? A. Gloves only. B. Gown and gloves. C. Mask and gloves. D. Face shield only. Answer B. Contact precautions require gown and gloves to prevent spread through direct or indirect contact. Which of the following is an example of a blood-borne pathogen? A. Streptococcus. B. Influenza virus. C. Hepatitis B virus. D. Rhinovirus. Answer C. HBV spreads via blood and bodily fluids, representing a blood-borne infection risk in healthcare. When is hand sanitizer acceptable for use? A. When hands are visibly soiled. B. When soap and water are unavailable and hands are not visibly dirty. C. After handling. C. Difficile. D. When washing is inconvenient. Answer B. Alcohol-based sanitizer is effective unless hands are visibly contaminated or dealing with spore-forming pathogens. Which task requires medical asepsis? A. Surgical wound dressing. B. Catheter insertion. C. Feeding a patient. D. Changing bed linens. Answer D. Medical asepsis reduces microorganism spread during routine, non-sterile procedures such as changing linens. What should be done if a CNA's glove tears during a procedure? A. Continue quickly. B. Replace gloves immediately. C. Wash gloves. D. Ignore unless contamination occurs. Answer B. Torn gloves compromise barrier protection. New gloves must be applied right away to maintain infection control. What is the correct action after exposure to blood? A. Apply alcohol and continue working. B. Wash the area and report immediately. C. Wait until the end of shift to report. D. Cover with a bandage and ignore. Answer B. Immediate washing followed by reporting ensures timely medical evaluation and reduces transmission risk. A resident with shingles requires which type of precautions? A. Airborne and contact. B. Droplet. C. Standard. D. Reverse isolation. Answer A. Shingles, varicella zoster, spreads through airborne and contact routes, requiring both protective measures. The CNA should clean a blood spill using A. Warm water. B. 110 bleach solution. C. Alcohol wipes. D. Plain detergent. Answer B. A 110 bleach solution disinfects blood spills by killing bloodborne pathogens effectively. PPE should be donned. A. Before entering a patient's room. B. After entering. C. When contamination occurs. D. At shift start. Answer A. PPE must be worn before entering isolation or contaminated areas to prevent pathogen exposure. A CNA's uniform sleeve touches a sterile field. What should be done? A. Continue with care. B. Ignore if brief. C. Notify nurse and replace field. D. Wipe with sanitizer. Answer C. Once contaminated, a sterile field must be replaced to maintain aseptic conditions. Which practice helps prevent urinary tract infections in residents? A. Limiting water intake. B. Keeping catheter bag above bladder level. C. Regular catheter care and keeping bag below bladder. D. Reusing collection bags. Answer C. Keeping the drainage bag below bladder level prevents backflow of urine and bacterial contamination. A CNA should perform hand hygiene after removing gloves because A. Gloves completely eliminate all contamination. B. Microbes can pass through microscopic tears in gloves. C. Gloves protect against all pathogens permanently. D. Washing hands after gloves is unnecessary. Answer B. Even high-quality gloves can have microscopic defects, allowing microorganisms to pass through. Washing hands after glove removal ensures complete removal of contaminants and prevents the spread of infection between patients. What is the correct way to dispose of a used needle? A. Break it before disposal. B. Recap it carefully. C. Place it immediately in a sharps container. D. Wrap it in tissue before throwing away. Answer C. Needles and other sharp items must go directly into a puncture-resistant sharps container without recapping or bending to prevent accidental needle stick injuries and cross-contamination. A patient on contact precautions needs a blood pressure reading. What should the CNA do? A. Use the same cuff for all patients. B. Use dedicated or disposable equipment for that patient. C. Refuse to take the measurement. D. Use any available cuff without cleaning. Answer: B. Patients under contact precautions require dedicated or properly disinfected equipment to prevent spreading infectious agents to others or contaminating clean areas. What is the best way to prevent healthcare-associated infections, HAIs? A. Wearing gloves at all times. B. Using antibiotics regularly. C. Proper and consistent hand hygiene. D. Wearing double masks. Answer: C. Hand hygiene is the single most effective way to prevent the spread of healthcare-associated infections by removing transient microorganisms acquired from contact with patients or surfaces. When should a CNA wear a gown? A. Only during surgery. B. When there is a risk of exposure to body fluids or secretions. C. When entering any patient's room. D. Only if the nurse instructs. Answer: B. A gown acts as a barrier when performing tasks where splashes or sprays of blood, body fluids, or secretions may occur, protecting both the caregiver and other patients. A CNA notices a spill of urine on the floor in a patient's room. What is the correct action? A. Leave it for housekeeping. B. Wipe it with paper towels only. C. Clean it immediately with a facility-approved disinfectant. D. Cover it with a towel and continue work. Answer: C. All biohazardous spills such as urine, blood, or vomit must be cleaned promptly using an approved disinfectant to prevent accidents and the spread of infectious agents. What is the correct procedure when removing PPE after patient care? A. Remove gloves first, then gown, mask last. B. Remove gown first, gloves last. C. Remove mask first, then gloves and gown. D. Remove all PPE at once. Answer: A. Gloves are removed first since they are the most contaminated, followed by the gown and then the mask, ensuring that the cleanest areas are touched last to avoid self-contamination. Which of the following best describes standard precautions? A. Only used for patients with known infections. B. Applied to all patients regardless of diagnosis. C. Optional if gloves are worn. D. Used only during emergencies. Answer: B. Standard precautions are infection prevention practices applied to every patient, assuming that all body fluids, secretions, and excretions may contain infectious agents. If a CNA's uniform becomes contaminated with blood during care, what should they do? A. Continue working until shift ends. B. Spray perfume to mask the odor. C. Remove and replace contaminated clothing immediately. D. Wipe the area with tissue. Answer: C. Blood contamination poses a biohazard risk. CNAs must remove soiled uniforms and change into clean attire immediately to prevent spreading infectious materials to others or to other surfaces. Why is it important to follow isolation signs on a patient's door? A. They indicate room decoration preferences. B. They identify infection control measures to protect everyone. C. They are only for visitors. D. They are not mandatory for CNAs. Answer: B. Isolation signs specify the type of precautions, contact, droplet, or airborne, that must be followed. Adhering to them protects patients, staff, and visitors from potential disease transmission within healthcare facilities.